we are here for your questions about the surgery. We are in the new hospital in Tijuana. We expect to open the next year, and it's all new here. The complete hospital is new, is first class, it's very comfortable, it's very it's big, it's all new. The OR are perfect, and it's a big space to get the surgery. And if you come in the future, um, you can see the installations, how big and how pretty are. So we will start with your questions. How many bariatric surgery have you performed? I think close to 10,000, more or less. So, Alexandria, I have my surgery date the 11th with you. Oh, nice. I will wait for you. I will remember you. 11 November, I think, right? Oh, December. Okay. I will put on my schedule to remember you. If you have any question, this is the moment. Of course, the day of the surgery, I will talk with you before surgery, so you can ask me any question you have since the moment. Hi, Lori. So we have some questions here. I this is the every week we are having these questions and answers time in Mexico Bariatric Center with different doctors here in the new hospital, trying to clarify all the doubts about the surgery. I know it's a big change, so you can ask anything any question you have is good. Uh, the idea is to be comfortable to get the surgery with any doubt about how you will be after or what you need to do to come, uh, especially if you have any um, uh, health problem like diabetes, or if you uh, had in the past any uh, clot problem, thrombosis, if you are taking blood thinners, any question you have, we can clarify. So, Mary, Mary says, when will I receive the post-op diet? Christmas is 4 weeks after my surgery. Um, we will we will give you the pre-op diet. Uh, Depend of your BMI. If your BMI is low, you will need just 1 week. So, it's there is no problem if you receive 1 week before the surgery the pre-op diet. If you are 40 to 50, 2 or 3 weeks. Most of 50 BMI, it's 3 or 4 weeks, depends. So if you are, uh, for now, it's 4 weeks, I think you are on time to receive your pre-op diet. Um, Let me see the next question. Lori, how many people end up needed relieving? How do we avoid this? Okay, the sleeve surgery is not a revision option. Okay, You need to know the sleeve is not a procedure accepting in the bariatric surgeries. We do sleeve to other procedure like bypass, mini bypass, duodenal switch, um, but not sleeve because the sleeve is dangerous. It is not working, and it's and in the narrow zones and at the end in leaks. So we are very strictly here to don't do sleeve surgery. But if you are asking us what you need to do to don't need a revision, any revision with your sleeve. Yes, it's a way to carry your sleeve. That is, don't put food with liquids at the same time. For example, don't eat much than your capacity because month by month you will see if you have your sleeve the um, restriction capacity it will be out increasing if you push more and more liquids and food. So the healthy diet, the healthy habits, it will be maintain your restriction for a long time, long term, to get this tool for more years. Then if you start very early to increase your amount of food and push, you will lose this restriction and you will have a little more capacity month by month to eat a little more, and that ends in, of course, regained weight and cold ends in our revisions. So what will be the reason, Robin? What will be the reason a doctor will cancel your surgery once you arrive here? Well, we check all the health questionnaires to be sure you are a good candidate to get the surgery with an extra pre-op evaluations at home. If we'll see you don't have any important issue like uh, hair failure before, or maybe this controlling your pressure, you if you have high pressure, or if you before have any um, condition like stroke or pulmonary disease or any renal disease, any health issue you had in the past, we will ask you some lab tests before you come. Like maybe if you mention it in your health questionnaire, you have chronic anemia, we need to see your hemoglobin in a normal lab test. But if you send the lab test and everything is good, it's very um, close to zero to cancel the surgery here. Of course, we do a pre-op evaluation here with our doctors, the internist, who check your EKG, your lab test, who we do here when you arrive here. If some is wrong, we will see how much risk you have. Of course, if the normal level is 12 in the hemoglobin and you have 11.8, well, you can get the surgery. But by other side, if the normal level is 12 and you have 8, of course, we need to cancel the surgery. But if you never seen any problem in your hemoglobin before and you don't mention it in the health questionnaire, we can know you had this problem. So if we have the surprise here, that is the unique reason we can cancel the surgery. Or if in the EKG we find some blockage, for example, or any important um, event, but it's very rare. The most of the patients know all the issues, the health issues they have, so we can ask the pre-op evaluation before come to be sure you will have the surgery, don't cancel because we know it's important. uh, you block your work days and just spend time to come and just spend money, of course, coming to cancel the surgery. And that is the reason we need that health questionnaire to see uh, if you have any special condition, and we ask some lab tests before you come to see everything is good to get the surgery. So, Robin, is true you lose 60% of your money if doctor cancels surgeries? Well, that is not my area, so I don't know how percent uh, you lose because uh, I, I, I think it's some of the coordinator area, but that is for they ask for to do to the coordinators. I don't know really how much, but you can directly ask to the coordinators. Okay, say how long should I wait before swimming after surgery? All the activities need to wait 6 weeks. Um, for swimming properly, you need to wait 6 weeks. But if you go to the pool just to walk around, when your bones are dry, you could go to the pool. Okay. Okay. All the money payments, all the about the money is directly with the coordinators. If you send your health questionnaire and have any any question about the money, the financing, everything is with the coordinators. I don't have idea about that. Okay, Alexandria, will I need time off for work? Yes. Desk job is 1 week. Uh, Medium work, like if you are just walking around and you have time to get sitting and get rest, is just 2 weeks off. But if you are lifting heavy things and you are doing a hard job, you need to wait 3 to 4 weeks. But for workout and very heavy lifting, you need to wait 6 weeks. So basically, you come to the hospital a day before the surgery, get the pre-op labs. Uh, we do a EKG. The day of the surgery, we do a pre-op evaluation with our internees. We check the lab test, the EKG. We check you physically and see if you are perfect to get the surgery. Every doctor talk with the patients before go for any extra question. The sleep surgery is around 1 hour. The bypass is 2 hours, 1.5, 2 hours, more or less. You go to the recovery room, and then we are with you all the time, checking you are coming from anesthesia with all problems. Until you be very wake up, you go to the room and you start to walk. The same day, you start to taking eye chips, and then the next day we will do a leak test. The second leak test, the first leak test is in the surgical room, and if uh, everything is good, we will start the liquid diet the next day. So the second day after surgery. All the patients are walking the same day of the surgery. Uh, they are ready to doing exercise breathing, talk with the family, everything. Okay. Um, Okay, Alexandria, do you tell us what we will need to buy at pharmacy? Yes, we will give you all instructions in your discharge papers, and we will explain every point, red flags about your recovery time at home, and your prescription. It will be in the papers. We will give you the antibiotic, uh, painkillers, and we will give you the prescription to buy medication for gas or nausea if is the case. Everything it will be explained before you leave. You will have our personal and company email for any extra question. We will be in touch all the time, so don't worry about the follow-up instructions, okay? And we will help you with all pharmacy, extra medications you need to buy, everything. Okay, the vitamins and protein, the question about the vitamins and protein. The patients starts the protein and vitamins the next week after surgery. In sleep surgery, it's 1 year, strictly 1 year with protein and vitamin because it's the time where it's the most um, aggressive weight loss time, for saying in one way, and we need to compensate that weight loss uh, uh, too fast. So the bypass, it's the vitamins and protein supplements for all your life. So you need to be checking in the bypass surgery year by year how is your levels of your vitamins. The most important, of course, is your hemoglobin, the iron, and the B12, the B1, B6, calcium, and depends of that we can um, do increasing the doses or not, the vitamins or the protein. And we will check your renal function in the lab tests too. And it's important to be checking your hemoglobin test every year because that is the most variable after the surgery who could decrease fast, and we need to increase maybe the B12 and iron and in the first year, the first 2 years to maintain the levels very well. So, Maria, do you have any patient who lost an extremely large amount of weight? No. If the surgery is uh, I think the question is in bad bad uh, bad main, right, bad way. Of course, the 80 to 100% of your excess of weight losing, that is not extremely, that is the normal goal in the surgery, but more than that is not a problem. um, that is just for if your surgery was successful, you don't have any issue, you will lose just your excess of weight. So don't worry about that. Is the 100% is the goal. We expect 80% with the we say it's a successful surgery, 80 to 100% of your excessive weight, and that is the most of the patients are losing. But more like extremely, it's just because you had maybe complication in the surgery, but it's not happening. It's that is because that was wrong in the surgery, but we don't have that problems. So how do you prevent or at least lessen the gas post-abdominal switch? Okay, well, that is the hygienic diet who it will be helping you in that way. We need to be careful about how much sugar we are eating because that promote to have that gas problem. So the dumping syndrome, it's um, many different symptoms who involve that syndrome, and one the gas problem is one of the symptoms. The uh, low glucose in your blood because we are stimulate the body um, get a hyper reaction from the glucose directly to the small bowel, and that produce more insulin from the pancreas, and we have this dumping syndrome problem. But that is correspond if you are eating bad, if you are don't having any hygienic diet, if you are doing the hygienic diet, and you uh, avoid this possibility to have any problem about the gas and dumping syndrome. Okay, what's the protocol for the balloon out? Well, I just you need to just to program it your balloon and to the an endoscopy before because it's a minor procedure. It's just a sedation, so you don't go to the general anesthesia. It's just a sedation, and you will be ready in a few hours. But we care depends if you are having any issues with your balloon, and then we will see if we need a special preparation for you. If not, it's very simple. Actually, I don't do balloons, so if you are thinking in remove your balloon, the doctor who accept you, it will give you all instructions before you come, but it's simple, it's not complicated. What is the best bariatric surgery you suggest for someone who already has sleeve surgery? Is a sleeve recommended and effective? Or you recommend a sleeve to bypass or mini bypass? Um, this is depends of your BMI. If depends how much you regainate, how much weight you regainate to, because it's important to study the patient. Is not just to say this is the best. Is the best for you or for other patient is other option depends if you are having um, if you are sugar eating, of if you are a volume eating, or if you had how much time you had the sleep, and in how much time you regainate all the weight, or if you don't regainate all the weight. So it's different for everyone. I If you have problems with acid reflux, for example, the best option is the full bypass. So if you send the health questionnaire, we will see what happened, how much you regainate, and how much time you regainate the weight, if you have acid reflux or not. So we will see what is the best option for you. I like so much the full bypass for sleep after the sleep surgery. The sleep is not an option. I mentioned it in the first questions that sleep is not a revision surgery. Sleep is not a revision surgery. It's dangerous for the patients, could end in narrow zones, leaks, obstructions, and it's not improving in your weight loss again, so it's not an option sleep. Okay, Sergio, hola. Um, Alexandria, if you had gallbladder removed, would you be going through the same incision site? If it's in my way, yes. One of the incisions could be, or both, or two, the upper part and the left part, but the right side, no, because the my right side, your right side, it's where it was the gallbladder, but your left side is clean from scars, and that is the part we are going to work now in the sleeve. So maybe could be one or two incisions, but the other side it will be news. Maria, will weight loss surgery work if I have thyroid issues? Um, Actually, we see improving in the thyroid problems when the patient lose weight. A lot, I think I can say maybe the 50% of the patients have thyroid problems, and it was good to get the surgery. Just of course, if you are taking medications, you need to continue taking, don't stop. And after the surgery, in your control test, lab test, you will see you will improve in that thyroid problems. A lot of patients um, resolve the problem with the thyroid because the obesity is some in some patients is the cause of the thyroid problems, but it's not uh, the treatment, but helps. Okay, can you please talk about how to prevent loose skin? Um, the that is not a problem. Actually, we have been seeing in all these years and our experience, the skin is shrinking with your body at the same time. Of course, it depends of the age. If you are a little more old, like 60, uh, it's a little more chance to get lose weight, lose skin. But if you are less than 50, the most of the patients don't have any problem. Of course, if your BMI is 60 or more, you will have a loose skin, but less of 50, it's just very um, low the possibility to get loose skin. Okay, Angie. Hey, Dr. Valenzuela. I might sleep with you on September 4th. Lost 50 pounds so far. I am your total fan. Thank you. Thank you, Angie. So send some pictures to my personal email to see your advances. Uh, it's a great improve in such short time, and you are having a great results. Okay, Maria, how much time does it take to recover, and how long does it take to get surgery? Um, the to normal activities at home is 1 week. If you need to come back to work, if it's desk job, it's 1 week. If it's a relaxed job like medium activity walking, is 2 weeks, 15 days. If you are having a um, hard work, lifting things or more than 15 pounds, then you need to wait 6 weeks. Daniela, hi. Are the chance of complications increase with the bypass compared to the sleeve? Well, of course, the bypass get a little more risk than sleeve because we are having um, three different parts cutting in your uh, gastrointestinal way. So we cut the pouch in your stomach. We cut the small bowel in two different parts to do the anastomosis, and of course that increase the risk to get a little bleeding or other issues. But our experience is for the 10 years, so uh, we are having very low uh, ends to complications, and percent of complication is close to zero even in bypass, because we are having a lot experience all this through all these years. So I think it's very safety, the gastric bypass too. um, don't worry, you don't have fear. If you need a bypass, it's a very good tool to resolve the glucose problem, diabetes, and syndrome, the ovary polycystic syndrome, and different issues like high pressure, thyroid, sleep apnea. It's a long-term good result, so don't worry. The bypass is a good surgery, low risk. Okay, the last question are I think it's all the questions here. So just Daniela, if you have any extra question about the bypass, send to us any any question you have, to be sure you are having the correct information. Okay, then the next week we will have a Q&A session. So another doctor will be here. Uh, put your question in a phone to wait the next week and ask to other doctor here to resolve any question you have. Okay, we are happy to respond, and see you in the next time. Okay, bye.